Ever felt like your mind is a tangled mess of yarn, and you just don't know where to start pulling the thread? Or maybe you've supported a loved one through a mental health challenge and seen how crucial the right care is. Well, today, we're shining a light on some of the unsung heroes in the mental health field, Advanced Practice Psychiatric Nurses, or APPNs. You might have heard of them, but do you really know what they do? Stick around, because these incredible professionals are changing the face of mental health care, and you're about to find out how. So, what exactly is an Advanced Practice Psychiatric Nurse? Let's break it down. Think of a highly skilled, deeply compassionate healthcare expert who combines the art of nursing with the science of psychiatry. That's an AP. These are not your typical nurses. They are registered nurses who have gone back to school for a master's or even a doctoral degree, specializing specifically in psychiatric and mental health care. This advanced education gives them a whole new set of tools and a much deeper understanding of the human mind. They are trained to see the whole person, not just a diagnosis. This means they look at your physical health, your emotional state, your social situation, and your spiritual well-being. Altogether, it's a holistic approach that can make a world of difference. There are a couple of main roles under the APPN umbrella. You might encounter a psychiatric mental health nurse practitioner, often called a PMHNP, or a clinical nurse specialist, a CNS. While their roles can overlap, a nurse practitioner often focuses on diagnosing conditions and managing treatment plans, including prescribing medication, much like a psychiatrist would. It's a lot more than you might think. One of their core functions is assessment and diagnosis. They are trained to conduct comprehensive psychiatric evaluations, listen carefully to your story, and identify what's going on. They can diagnose a wide range of mental health conditions, from anxiety and depression to bipolar disorder and schizophrenia. But here's the key difference. They do it with a nursing lens. They are masters of therapeutic communication, creating a safe, non-judgmental space where you feel truly heard and understood. This relationship is the foundation of healing. Once a diagnosis is made, what's next? Treatment. This is where the advanced practice part really shines. APPNs are qualified to provide a full spectrum of care. A huge part of this is psychotherapy, or talk therapy. They are skilled in various therapeutic modalities, like cognitive behavioral therapy, or CBT, which helps you change negative thought patterns, or psychodynamic therapy, which explores past experiences. They don't just follow a script, they tailor the therapy directly to you. And yes, let's talk about medication. Many APPNs, especially nurse practitioners, have prescriptive authority. This means they can prescribe and manage psychiatric medications. This is a game changer for access to care. Instead of waiting months to see a psychiatrist, you can often get an appointment with a PMHNP much sooner. They combine their deep knowledge of pharmacology with their holistic nursing perspective. They'll talk to you about potential side effects, how the medication works with your body, and how it fits into your overall wellness plan, which might include therapy, lifestyle changes, and other supports. They monitor you closely and work collaboratively with you to find the right medication at the right dose. They empower patients and their families with knowledge. They'll help you understand your condition, your treatment options, and strategies for managing your symptoms in daily life. This education is incredibly powerful because it turns you from a passive patient into an active participant in your own recovery journey. They can also connect you with community resources, support groups, and other services that can provide an extra layer of help. You'll find APPNs working in so many different settings, which is a testament to their versatility. They might have their own private practice, offering therapy and medication management. You'll find them in community mental health centers, providing crucial care to underserved populations. They work in hospitals, on psychiatric units, in emergency rooms, doing crisis evaluations, and even on medical floors, helping patients who are dealing with the psychological stress of a physical illness. They work in schools, in correctional facilities, in veterans clinics, and through telehealth, bringing care directly to people's homes. They are everywhere, filling critical gaps in the mental health system. Because of their background in nursing, they have a solid understanding of physical health. Depression can cause physical pain, and a chronic illness can lead to depression. They might be the first to notice if a physical symptom could be related to a mental health issue, or vice versa. This comprehensive view leads to better health outcomes overall. psychiatrists are in short supply, especially in rural or low-income areas. This is where APPNs are making a monumental impact. They are dramatically increasing access to high-quality mental health care for millions of people. Research has consistently shown that the care provided by APPNs is safe, effective, and leads to patient satisfaction levels that are just as high, if not higher, than care provided by physicians. They are a critical part of the solution to the mental health crisis. So, if you're on a journey to improve your mental well-being, consider seeking out an advanced practice psychiatric nurse. They offer a unique blend of scientific knowledge, clinical skill, and the deep-seated compassion that is the heart of nursing. They see you as a whole person, they listen with intent, and they partner with you to create a path toward healing and recovery. They are advocates, therapists, prescribers, and educators all rolled into one. The next time you hear the term APPN, or PMHNP, you'll know you're talking about a highly trained expert who is dedicated to helping people reclaim their mental health and live their best lives. If you or someone you know is struggling, please remember that reaching out is a sign of strength. You can find qualified mental health professionals, including APPNs, through resources like the National Alliance on Mental Illness, or NAMI, or by asking your primary care doctor for a referral. If you're in immediate crisis, please call or text 988 in the United States to connect with the Suicide and Crisis Lifeline. There is hope and there is help available. Thanks so much for watching today and learning about these incredible professionals. If you found this video helpful, please give it a thumbs up and consider subscribing for more content that empowers you on your wellness journey. We'll see you in the next one.